Now, partial agonist and mixed agonist and antagonist. Partial agonist bind to opioid receptor, but they have less intrinsic activity than full agonist. That's why they are known as partial agonist. The effects depends on previous exposure to opioids. Individuals who are opioid naive mixed shows low agonist activity. Now, pentazocane. It acts as an agonist on kappa receptors and a weak antagonist or partial at mu receptors. That's why it is called mixed or partial. Now, it produces less euphoria compared to morphine, but in higher doses, respiratory depression, increased BP, tachycardia, hallucinations occur. It is rarely used in the management of pain. It does not antagonize the respiratory depression of morphine. Now, nalbuphine and butorphanol. These are mixed opioid agonists and antagonists like pentazocane, and they are used in the treatment of chronic pain. They are also available in nasal spray and has been used for severe headaches. These does not have effect on heart or increased BP, and they exhibit a ceiling effect on respiratory depression. Other analgesics. Now, tapentadol. It is a centrally acting analgesic. It acts on mu opioid receptors, inhibitor of norepinephrine reuptake. It is metabolized to inactive by glucuronidation. It does not inhibit or induce CYP450 enzyme. It is available in intermediate release and extended release formulation. Now, tramadol. It is centrally acting analgesic that binds to mu receptors. It undergoes extensive metabolism by CYP2D6, leading to active metabolite. It weakly inhibits reuptake of norepinephrine and serotonin. It is less respiratory depressant activity compared to morphine, and naloxone will only partially reverse tramadol toxicity. Drug-drug interactions are with SSRI, MAOI, TCAs, as well as other agents which bind to mu receptor. Tramadol has been associated with misuse and abuse. Now, antagonist. Stage 1. These are the signs and symptoms: up to 8 hours, anxiety and drug craving. For 8 to 24 hours, anxiety, insomnia, GI disturbances, rhinorrhea, mydriasis, diaphoresis. Stage 3. Up to 3 days, tachycardia, nausea, vomiting, hypertension, diarrhea, fever, chills, tremors, seizure, and muscle spasm. These are all withdrawal syndromes. Now, naloxone is a competitive antagonist, mu, kappa, and gamma receptors, delta receptors. It can reverse the effects of morphine overdose, such as respiratory depression and coma, within 1 to 2 minutes of IV administration. Naloxone is available in an auto-injector and nasal inhaler for community distribution for treatment of opioid overdose involving heroin or prescription opioids. Naltrexone has similar action to those of naloxone. A single oral dose of naltrexone blocks the effect of injected heroin up to 24 hours. It is used for rapid opioid detoxification.